You're still watching Africa Today. Doctors working in the Kenyan state-run hospitals have rejected a government offer aimed at ending a 3-week-long strike that has severely disrupted health services. The Kenyan Medical Practitioners, Pharmacists and Dentists Union, which represents more than 7,000 members, went on strike on the 15th of March, demanding a payment of salary arrears and the immediate hiring of trainee doctors, among other grievances. For more on this discussion, we're now joined by Union Secretary-General Dr Davji Atellah, who joins us from the Kenyan capital, Nairobi. Dr. Atellah, thanks for your time. Let's start off with some of the grievances that you have on the table, and these include a payment of salary arrears. What percentage salary increment did you agree with the Kenyan government, and what were some of the agreements that were reached at the point?
Thank you so much, Ugo. We are on strike because the government has not implemented the collective bargaining agreement that was signed in 2017, of which there was a basic salary component that was increased at that time that has never been paid to the doctors in the running down 7 years. We tried to engage the government in 2020 for this, but then they did not respond positively. And therefore, we got a court judgment that favored the doctors, that directed the government to pay these basic salary arrears within 60 days. But we are now on 615 days later. This has not been paid. And therefore, with the increasing inflation in the country and the fact that the salary has never changed for doctors for the last 7 years, therefore, we were demanding for this particular salary arrears to be paid, and then it be implemented the pay slip of the doctors. Again, there's also something regarding the employment of doctors, particularly in two ways. Number one, we have medical doctor interns who graduate and are supposed to be posted to various hospitals across the country, offer services, of which this year we had about 1,300. So government has not posted them to the various hospitals so they can be licensed. It also means that the public cannot get services in the public hospitals as expected because of the shortage. So we were demanding that these particular medical doctor interns be posted as per the collective bargaining agreement that we actually anchored the remuneration rates. The also other thing that you are advocating for was the medical cover for doctors. Doctors are offering services in Kenya which themselves they can't afford. And therefore there was ultimate need for government to provide the medical insurance for the doctors who are working. Those are some of the issues that may lead to the strike that began on 2024. Today is day 23 of the nationwide strike. And again, when we were trying to do negotiation with the government, we realized that they were not interested really in solving the issues, but giving empty promises, because they have been giving promises before and they don't implement it, which they call it goodwill, but we've been saying that is ill will, because goodwill is dependent on the fact that if an issue is agreed upon, it to be implemented. You don't start having blame games and say that this was done by different governments, yet governments are continuing process.
So Dr. Atellah, let's look at the implications of the strike that you and your colleagues are on. How many hospitals are impacted, and what's the impact been on the average Kenyan citizen who goes to a hospital, goes to a clinic looking for treatment?
I think here it's part of the government that is not responsible, that has relegated its duty, that has decided not to be accountable on the issues that have been put for it. We particularly say that as doctors, we are particularly not on strike. We join the government that are on strike, and because it's the government that's responsibility to actually build hospitals and to furnish them with the drugs and with equipment. So to this case, we are going on strike because we are not able to be supported to actually offer services to those hospitals. So the government must take responsibility of their inaction at this particular point. I know it has affected almost 90% of the hospitals across the country, that the public cannot get services. But our constitution is the responsibility of the government to provide care. Otherwise, if the government was responsible enough, they would not be walking out of the negotiation meetings. Because we've had a negotiation meeting where we have the head of public service, we had the governors of the different counties in the country, different ministers, but then they decided to walk out of this particular talk. It means that they don't care whether the public gets care. They don't care whether the strike goes for 100 days the way it went on 2016, 2017. And therefore, if the government can lie to doctors, can give promises and not implement, can sign a collective bargaining agreement and ignore, it means every Kenyan then is not safe. They can lie to everybody. to the point that we have seen a very injustice and immorality being met upon the doctors, whereby last week, yesterday, we saw the government saying that they have offered 2.4 billion for paying the medical doctor interns, and we realize that it's just more of a propaganda in the sense that they have reduced the salary of these doctors by 91%, from what they were earning about $1,800 to about $300. It's a clear indication that the government is acting and treating doctors with bad will or ill will, and they're not particularly concerned in implementing the issues that we presented to them.
Now, one of the issues is that this agreement was arrived at before President Ruto took over. Is that correct?
No. Government is a continual process. It's not an individual person in the office. Government is a continuous process. And I must tell you that the persons that are in office today has just changed the positions. For example, at that point, the current president was a deputy president. The head of public service today was a minister of agriculture. So the person that we were negotiating with, the collective bargaining agreement, the civil servant or directors who were permanent in different offices, in the office of the president, in the Ministry of Health, the same director general was there in all these particular departments. The same people that we negotiated with this collective bargaining agreement now are saying it is impossible to implement it. And we cannot say that government is different. The government is the same. The difference is just the people. We've seen the government paying the Eurobonds, paying bills that are liabilities of the previous government. So we cannot start saying that the issues that were discussed and signed legally by the persons who were in the office in the previous government cannot be implemented by this government. We have one constitution, and it's the constitution that has provided for the labor movement, which we have a collective bargaining agreement that was signed, not by individuals, but by officers. And therefore, its implementation requires the same responsibility and accountability. But here we have seen a situation whereby doctor interns have been handling particular salary that was negotiated for 7 years. Now, new government or new persons in office feel like that is too much money, and they reduce it 91% unilaterally without having to have a discussion with the union. That we find to be a violation.
Now,
and it means that no worker, not only doctors, no any employee in the country will feel safe with their collective bargaining agreement if it is being violated in such a manner. And that's why we are on strike up to the point that the government will realize that there is dignity and there is value that doctors ought to be given when they're being treated on their issues.
Now, your issues aside, aside the fact that government has made a promise to you in 2017, I think it is, that they would make certain payments, and they haven't done that. How do you feel? What sort of emotions do you go through and your colleagues go through when you hear that little babies have died in hospitals or mums have died because they've been unable to give birth? I mean, it must be a conundrum for you because the government's made an obligation that they are refusing to keep. You, on the other hand, are saying, I'm not prepared to work, but you still love the patients. I mean, the reason that you're a doctor is because you want to save lives.
Doctors take a Hippocratic oath that says, do no harm. And you can only do harm to a patient when you are seeing them in the hospital. When you are not in the hospital, then you have no responsibility about a particular patient because you yourself can also be a patient. And that is the reality. It is then the responsibility of the government that actually constructed these facilities to ensure that they give care to the people. We pay taxes the same way every Kenyan pays taxes. And therefore, if the government has not taken its own responsibility, it means that it is them that are causing the death that we are seeing in the country. And I must say that a lot of times we as a union have seen worse situations. We don't have medical insurance, as I've told you, so it forces doctors to actually contribute to ensure that our colleagues get care. Last week, we lost about 2 doctors who could not get care because we had to pay for them. We have seen doctors going under mental distress because they have the salary are delaying up to 4 months, 5 months are not paid. So in reality, yes, you're a doctor, you have a stethoscope, you have instruments for work, but you cannot go to a petrol station and say, oh, I'm a doctor, I have a stethoscope, give me fuel so that I can run to the hospital. You cannot tell your landlord that I'm a doctor, I have my lab coat, then treat me. We must come to a point that we treat doctors as essential workers as such also in budgeting. You can't be an essential worker to be in the hospital when you cannot feed yourself. But then when it comes to budgeting, then we budget to buy other things, to construct roads, to build hospitals without looking keen that they need to have workforce. We cannot say that. We can't insist. If doctors and health workers are essential providers, then that also should reflect the budget of the country. They should not be treated like second-hand citizens in the same country whereby their salaries are being unilaterally reduced by 91%. It means that they are not valuable to the country. And another case that we are demanding here, we are demanding for doctors to be employed. But in essence, when doctors are employed, they don't treat each other, they treat the public. It means that if you go to a public facility, the waiting time goes down. You will be attended to at the right time. And I must also tell you, Hugo, that KMPDU, the Union for Doctors, has made the tension of doctors in the public facility higher. Before the union, in 2009, before 13 years ago, none of the doctors was there in the public hospitals. The government could not retain doctors. They were graduating and leaving the country. They were graduating and going to the private facilities. It is through doctors' collective bargaining that they insisted that made it possible for the public to retain doctors. So our action that we are doing now is to make it possible for the public to access care. Sometimes we must take the sacrifice so hard that when you go to these hospitals, we don't see them as deathbeds, the way they have been, where our role is only to certify a patient that he has died, because we are not supported with drugs, we are not supported with equipment that we need. In overall, our actions is actually to make healthcare accessible once the government actually takes this matter into considerations.
Final question before we let you go, Dr. Atellah. What is it going to take to get the various doctors and medical personnel in Kenya back to work?
One thing, the government must give doctors the dignity that they deserve, and therefore they must honor agreements that have been signed. They must give us a framework and a plan to pay the basic salary arrears that they have not honored for the last 7 years, and then obey the court orders that we got based on that particular CBA. The government must follow the dignity of doctors and pay the intermedical doctors as per the collective bargaining agreement that we had. They should not reduce the salaries to 21%. The government must give us a plan that they're going to employ about 10,000 doctors in the next 5 years, because we want people to access care. They must give us an assurance that the hospitals will be having drugs, will be having equipment, and will be able to treat patients, not refer them to private hospitals, so that people can get care. Those are the fundamentals that you have asked for. That we must have plan structure that will ensure that doctors actually specialize, that they can serve the public. Those are the things that we are demanding to be sorted out, or a framework for the implementation be given with a clear-cut timelines. But in this case, this time, we are not just looking for promises. We want real action, because when somebody gives you a promise and tells you they have goodwill, it is important that that promise is followed by an action. But when that is not happening, then the goodwill turns to ill will, and nobody can believe such promises anymore. And that's why we are on strike. So when we are on strikes, we don't just take promises, we take action. When we are working and meeting government to discuss the issues, then we take promises. That's why this strike may take long, because we want results.
Dr. Atellah, appreciate your time and certainly wish you all the best, and we would like to see you and all the other doctors back at work as soon as possible. Dr. Davji Atellah, Secretary-General of the Kenyan Medical Practitioners, Pharmacists and Dentists Union, speaking to us. So that prolonged strike is stemming back to a promise made by the Kenyan government that goes all the way back to 2017.